Welcome back to my YouTube channel. My name is Levina and I will be your instructor for today. And today we are going to talk about providing mouth care to a resident who has teeth. We'll start again by looking at our checklist. We'll start from number 3. It says, assist resident to sitting position in bed by raising head of bed and using pillows as needed to position resident upright at 60 degree to 90 degree before offering fluid or brushing teeth. Remember, this skill is live person skill. You're going to perform this skill on one of the students on that day. So before you start brushing this resident teeth, you want to make sure the person is seated upright at least 60 degrees. Protect resident clothing before providing mouth care and remove protective cover when care completed. You will have to cover this person's clothing with a towel. You are protecting the patient's clothing from spills, water, or toothpaste. Moisten toothbrush with water and apply toothpaste before brushing teeth. You don't want to put toothpaste on the brush before you wet the toothbrush. You must wet the toothbrush before you apply toothpaste. Wear gloves when brushing resident teeth and wear throughout mouth care, including when rinsing basin and toothbrush, meaning you must use glove. You must wear glove when you are brushing the resident teeth. Brush sides and biting surfaces of teeth and the gum line with a gentle motion. Offer resident cup of water to rinse mouth after brushing. Provide resident an emesis basin or disposable cup to use for spitting as needed, such as after rinsing mouth. Leave area around resident's mouth clean and dry when care completed. Complete skills: having rinsed, dried, and stored basin, placing soil linens in hamper, disposing of trash, and leaving over bed table dry. Brushing resident teeth. We brush our teeth every day. When we're brushing our teeth, do we lie down when brushing our own teeth? The same thing applies to your resident. You want to make sure this patient is sitting upright at least 60 degrees. You want to make sure you protect the patient's clothing. You want to make sure you wet the toothbrush before you apply toothpaste. You want to make sure you brush the upper, the lower, the gum line, including the tongue of this patient. You want to make sure you clean the patient's mouth after you finish. Remember, you must wear gloves when performing this skill. This is the simple steps or the things you have to do on that day to get the full points. Now let's go over some likely questions that might come out based on this particular skill. If you have a patient who is unconscious, how often do you brush the patient's teeth? That is oral care. At least every 2 hours, 3 hours, 4 hours, or 5 hours. The answer is at least every 2 hours. What are you looking for when you are doing oral care? When you are brushing your patient's teeth, when you are doing oral care on your patients, what are the things you need to look for? What are the things you would report to your nurse when you notice them in your patients? Signs of infection, such as redness, swelling, lesion or abscess, And then you have to report any unusual findings to the nurse immediately after oral care is complete. There is nothing much in oral care or brushing patient teeth. We do that every day, and I hope when you see questions on this particular skill, you will be able to answer them. Remember our patients that are not eating by mouth. When you say somebody is unconscious, yes, we have to brush at least every 2 hours. What about those patients that are not eating by mouth? So we still have to do oral care at least every 2 hours. Thanks for watching. I hope you enjoyed these little tips. If you do, please subscribe and hit the notification button. Thank you and good luck in your exams.